is a juvenile justice social worker for La Crosse County Human Services, Heather Johnson. All of her professional work over the past 15 years has been with youth and their families in the child welfare system. This includes 10 years working with Child Protective Services cases. Heather is a graduate of Winona State University with a degree in sociology and a minor in criminal justice. Welcome, Heather.
First of all, I wanted to thank everyone for taking the time out to attend this evening on such a, what I believe is an important topic for our youth in this community that we're facing today. I was asked to speak from a juvenile justice perspective, representing La Crosse County Human Services on kind of what we're seeing, some trends, and kind of what's working, maybe where are some of the gaps in services. So I was fortunate enough that I have great coworkers, and I was able to ask them so you have a collective point of view and not just mine. Because I also work with juveniles on my caseload, I also asked some of them some of these questions, some with mental illness and some without mental illness. So I thought it was good to bring that perspective to you as well. So usually kids or youth enter my juvenile justice system because they have committed a crime, a disorderly conduct or a battery. And oftentimes when someone, myself or a therapist or someone else, looks a little bit deeper, very often underneath that iceberg is some sort of mental health diagnoses. Now, it doesn't give an excuse for as to why they're acting that way, but it certainly helps explain and understand why that may have happened and gives us a better tool in trying to prevent that. I feel like in our juvenile justice system that we are seeing a lot more young youth with some pretty significant mental health issues, such as ODD, attachment and trauma disorders, bipolar, conduct disorder, depression, intermittent explosive disorder. And those are some pretty tough diagnoses, and what we really see is parents struggling on how to manage those behaviors. I think, in my opinion and my coworkers' opinion, what's working is to continue these community conversations, because I think they are very important to get the community together and collaborate. The other thing I think that's working well is, like Mr. Nelson mentioned, that we have a very resource-rich community, and I think that is wonderful. Also, I'd like to say just the collaboration amongst community members, whether that be the hospitals, the schools, whoever is involved in this youth's life has been very nice to see at La Crosse, and I really see that as a goal. No one person can do this alone. I think it's very important to support the parents or caregivers of these children with mental illness, because it is tough for them to care for them on a consistent basis. I was also asked to speak about what we see as some of the gaps in our system. And some of the gaps that we saw was the lack of psychiatrist availability for children specifically. Oftentimes there's a waiting list of sometimes months, and this is no fault on any of the medical systems here, it's just what it is, and I'm sure they wish they could fix that as well. But that's a huge gap. Even if, say, a child had a suicide attempt or was in the psych ward, sometimes the follow-up to see the actual child psychiatrist when you're outpatient can take forever, it feels like. And in the midst of that crisis that youth and that family is, they really don't know where to turn for services. I think it's difficult at times for families just to get connected and know where to go, especially those families that maybe don't attend the parent-teacher conferences, the ones that are kind of disengaged from the school or disengaged from the community for that matter. I think what's working well also is La Crosse County has a mobile crisis system that is in operation 365 better with youth in this situation, with the mental illness, is to do more of a therapeutic versus a punishment approach. What we've learned is the punishment doesn't really get, again, to that root cause of why are they acting out, why are they in their system, why are they having a hard time functioning. So really taking on that therapeutic approach versus punishment. And then also, again, looking at alternative therapies, because a lot of our youth today, from my experience, don't like sitting down in a counselor's office, looking them in the eye and talking about their problems. That's really hard for a kid to do. It's hard for an adult to do. So it's